Hi guys, today I'm going to give some informations especially for the nurses. This video will be really useful for you guys, okay? So stay tuned. At the end of the video, you will get a clear-cut idea regarding the water loss score and also how can we prevent the pressure ulcers following certain techniques, alright? As a nurse, we must know all these things so that we can give an effective care to our patients. So let's begin. Water loss score is a tool to identify the risk of developing pressure ulcers. Is that clear for you? In other words, water loss score calculates the risk of pressure ulcers developing on an individual basis through a simple points-based system. Okay, it consists of 7 items. It's like a tick box exercise, and we can easily predict the patient's level of risk and we can give care accordingly. So the score of less than 9, which means the low risk, and a score of 10 to 14 indicates at risk. A score of 15 to 19 will be the high risk, and more than 20 indicates a very high risk. So for better understanding, what I'm going to do is I'm going to calculate water loss score for me. Okay, so this is the water loss score calculator. Of course, I'm a female, 35 years old. BMI will be around 20 to something, and skin is dry, mobility fully mobile, continence okay, complete, and recent weight. Yes, I have a weight loss 5 kg. Okay, then I have a poor appetite, tissue malnourishment, no neurological deficit, no major surgery or trauma. Then I'm not taking any medication, so none. So let's calculate. I'm eagerly waiting for my score. It's 6, which means no risk. I hope well explained. So let's move on next topic, which is how to prevent pressure ulcers. In UK, we are following 7 steps to protect our patients from pressure sores. That is asking, ASSKING. A for assess risk, S for skin inspection, surface, keep moving, incontinence or moist, nutrition or hydration, giving information. Okay, anyone can develop a pressure ulcer, so we have to assess the patient has any risk factors like skin type, and they have any other long-term health issues like diabetes, renal disease, stroke, or other factors such as history of smoking or alcohol, like that. Okay, so we have to assess the risk. Next is skin inspection or skin assessment, where we have to inspect the main pressure areas for any evidence of pressure ulcers such as redness or blisters. These all are the main pressure points, okay? So make note of it. However, we should always remember the safeguarding policy. As a nurse, we have to protect the health, well-being as well as human rights of our patients. Provide privacy and dignity at all times, explain each and every task, and get concerned before proceed. Okay, we have to respect their feelings and their decision as well, because they have the rights to refuse. They can refuse anything. They can refuse their medications, they can refuse their care, they can refuse their food either. Okay, in UK it is very important. We should not force them for anything, because here patients first. Patient is our priority. Next is the surface. We have to provide a proper bed depend upon the patient needs. We have to provide like air mattress or cushion, or high quality mattress, whatever. Okay, and also ensure that patient is more comfortable. The next is keep moving. We have to reposition the bedridden or bedbound patients every 2 hours. This is not a new information, every nurse knows, right? Also, we should encourage them to do some minimal exercises if they can, okay, which will also helps to prevent venous thrombosis. This also everyone knows, right? The next is incontinence or moisture. So we have to keep our patient clean and tidy at all times. We have to clean then and there because moisture is the pleasant atmosphere for the bacterial growth. The next is nutrition and hydration. We have to provide right diet and also adequate amount of fluids, plenty of oral fluids to maintain the skin integrity. Okay, so that's all. Then one more thing, that is giving information. We should give a proper handover to our colleagues so that it will not compromise the patient care. Okay, as you know, prevention is better than cure, so it's better to take action before harm occurs. Am I right? As a nurse, we are the full responsibility of our patients because we are looking after them or carrying them or being with them for 24 hours. So everyone has the responsibility to keep our patients safe. We are accountable for whatever we do. Okay? Next, I am going to categorize the pressure ulcers as 1, 2, 3, 4. Okay? One is intact and non-blenching. Non-blenching, how you will identify? Just you can, if you notice some redness, you just give a gentle pressure over there and find that is blenching or non-blenching. Okay, then category 2, which is superficial skin loss and blisters, like blisters, as you know, fluid filled blisters. Category 3, deep skin loss, and 4, which associate the bones, tendon, muscles. Okay, it's horrible. As we know, the pressure ulcers takes time to heal. So if you follow the 7 steps, we can highly reduce the risk of developing pressure ulcers. As I already mentioned, prevention is better than cure, so we have to act on it. Okay, thank you so much. Have a good day.